3 in the morning. A 9-month-old baby girl in Chicago suddenly burning up with fever. Her mother thought it was just a common cold. But when they arrived at the emergency room, the doctor said bacterial meningitis. If they had waited just 4 more hours, the outcome could have been tragic. Every year in the United States, over 40,000 children under age 5 are hospitalized with serious fever-related conditions. But 70% of parents don't know the critical warning signs. This information could save your child's life. Most parents, when they feel their baby's forehead and it's hot, they think maybe it's teething or just a virus. They give some infant acetaminophen, put on lighter clothes, and wait, because that's what their pediatrician, their own mother, or maybe something they read online told them to do. But here's what pediatric doctors across America worry about most. A fever that seems harmless could be a sign of something serious, and the window of time to act could be just 6 to 12 hours or even less. After that time passes, complications can develop that affect the brain, the organs, or the bloodstream. According to data from the Centers for Disease Control, last year alone, there were over 75,000 emergency room visits for infants with high fevers. 23% of those cases arrived at the hospital too late for optimal treatment. Not because parents didn't care, but because they didn't recognize the warning signs that required immediate attention. Dr. Elena Martinez from Boston Children's Hospital says, parents need to trust their instincts, but they also need the right information to know when a fever is just a fever and when it's something more. So how do you tell the difference between when to watch and wait and when to rush to the emergency room? First, let's understand what a fever actually is. A fever is when your baby's body temperature rises above 100.4 degrees Fahrenheit. In babies, especially those under 6 months, their immune systems are still developing. They haven't been exposed to many viruses or bacteria yet, so they don't have the antibodies to fight back effectively. Secondly, a baby's airways and organs are much smaller than an adult's. So when there's swelling or inflammation from an infection, the impact is much more significant. Third, babies can't tell you what hurts or how they feel. So when early symptoms appear, parents often miss them entirely. Now, how common are fevers in babies? Fever isn't rare at all. Globally, studies show that children under age 2 average 4 to 6 fevers per year. In the United States, pediatric data shows similar patterns, especially during fall and winter months when respiratory viruses spread. The numbers can increase by up to 40%. The most vulnerable age group is infants under 3 months old. But fevers can happen at any age during childhood. This is the most important part of this entire podcast. The warning signs you absolutely need to know. I'm going to break this into 3 levels. Mild symptoms, where you can monitor at home. Concerning symptoms, where you should call your pediatrician the same day. And emergency symptoms, where you need to go to the ER immediately. Level 1, mild symptoms you can watch at home. If your baby only has these symptoms, you can monitor them for 24 hours. First symptom, a temperature between 100.4 and 101 degrees Fahrenheit. Taken rectally, which is the most accurate method for infants. This means your baby's immune system is responding to something minor. It's normal because their body is learning to fight. Second symptom, baby is still eating and drinking. Maybe not as much as usual, but they're still interested in feeding. This is also not too concerning as long as they're having wet diapers at least every 6 hours. Third symptom, baby is fussy but can be comforted. They might cry more than usual, but when you hold them or rock them, they calm down. However, please note, even with mild symptoms, if the fever lasts longer than 3 days, or if your baby becomes more lethargic, stops eating, or seems worse, you should still contact your pediatrician. Level 2, concerning symptoms that need a same-day doctor call. Now we're talking about warning signs that you shouldn't ignore. You need to call your pediatrician within a few hours. First warning sign, temperature between 101 and 103 degrees Fahrenheit, especially if your baby is under 3 months old. Why is this concerning? Because in very young infants, their immune systems can't contain infections well. What starts as a simple virus could progress quickly to something more serious. Second warning sign, decreased urination. If you notice fewer than 4 wet diapers in 24 hours, or if the urine is dark yellow and concentrated, this could indicate dehydration, which needs medical evaluation to prevent complications. Third warning sign, persistent crying that's unusual, especially if combined with pulling at the ears or arching the back. This could suggest an ear infection or other painful condition. When you call the doctor, make sure to mention your baby's age, exact temperature when it started, and any other symptoms you've noticed. This helps the doctor assess how urgent the situation is. Level 3, emergency symptoms that require immediate ER visit. These are the signs where you don't wait. Call 911 or drive to the emergency room right away. First emergency sign, fever above 104 degrees Fahrenheit in any infant, or any fever at all in a baby under 8 weeks old. What does this look like? Your baby's skin feels extremely hot to touch. They might be sweating or shivering. Why is this an emergency? Because high fevers, especially in newborns, could indicate serious bacterial infections like meningitis, urinary tract infections, or bloodstream infections. If not treated within 12 to 24 hours, these can cause permanent brain damage or organ failure. Second emergency sign, difficulty breathing or rapid breathing. How do you check this? Count your baby's breaths for 1 full minute while they're resting. For infants under 1 year, more than 60 breaths per minute is too fast. Also watch for nostrils flaring, ribs pulling in with each breath, or grunting sounds. If you see these, this is respiratory distress. The baby needs oxygen support, possibly right away. Third emergency sign, extreme lethargy or unresponsiveness. Many parents confuse normal sleepiness from fever with dangerous lethargy. Here's the key difference. A baby who's just sleepy will wake up when you touch them or talk to them. But a lethargic baby is hard to wake, makes weak cries, and seems floppy. Fourth emergency sign, any seizure or convulsion. This looks like rhythmic jerking of arms or legs, eyes rolling back, stiffening of the body, or loss of consciousness. Even if it only lasts 30 seconds, this requires immediate emergency care. Remember, with babies, especially under 6 months, conditions can deteriorate very quickly, from mild to severe in just hours. If you're unsure, always choose the safer option. Get your baby checked. Now let's understand why fevers happen. The number one cause, viral infections. These are respiratory viruses like RSV, influenza, or common cold viruses. They spread through respiratory droplets when someone coughs or sneezes nearby. Most common during fall and winter months in the United States because people spend more time indoors together. Cause number 2, bacterial infections. Less common than viruses, but more serious, like ear infections, urinary tract infections, or pneumonia. Additionally, some factors increase the risk, such as attending daycare, having older siblings, or being born prematurely. But here's what's important. Even if you do everything right, your baby can still get sick because viruses are everywhere and babies' immune systems are still learning. This is not your fault. So when your doctor says your baby can be cared for at home, here's exactly what you need to do. Step 1, give appropriate fever-reducing medication. Specifically, infant acetaminophen is safe for babies 2 months and older. The dose is 10 to 15 milligrams per kilogram of body weight, given every 4 to 6 hours as needed. Never exceed 5 doses in 24 hours. Step 2, keep your baby hydrated. How? Offer breast milk or formula more frequently than usual in smaller amounts. For babies over 6 months, you can also give small sips of water. Step 3, dress them lightly. This helps their body release heat. Use 1 layer of clothing and a light blanket. Keep the room at a comfortable temperature, around 68 to 72 degrees. Step 4, monitor closely. What to track? Temperature every 4 hours, number of wet diapers, feeding amounts, and your baby's behavior. Write it down so you can see if things are improving or getting worse. Common mistakes parents make? 1, using cold water baths to reduce fever. This can actually cause shivering, which raises body temperature. 2, bundling baby up to sweat out the fever. This traps heat and makes things worse. 3, giving medication on a strict schedule, even when fever is gone. Only give it when baby actually has a fever or is uncomfortable. Prevention is better than treatment. There are 4 key ways to reduce your baby's risk. Method 1, keep up with vaccinations. Specifically, follow the CDC's recommended immunization schedule, starting at 2 months. This includes protection against pneumococcal disease, Hib bacteria, and influenza. Research shows vaccination reduces serious bacterial infections by up to 90%. Method 2. Practice good hand hygiene. How to do this? Wash your hands with soap and water for 20 seconds before touching your baby, especially important during cold and flu season from October through March. Method 3. Limit exposure to crowds. Many parents overlook this one, but for babies under 3 months, avoiding crowded places significantly reduces infection risk. Also remember things to avoid. Letting people kiss your baby's face or hands because viruses spread through saliva. Exposing baby to cigarette smoke, which damages airways and increases infection risk. Skipping regular checkups because early detection helps. Keep in mind, no prevention method is 100% effective, but combining these strategies will significantly lower your baby's chances of getting sick. Let's recap the most important points. 1. Know the 3 levels of symptoms. Mild means monitor at home. Concerning means call the doctor. Emergency means go to the ER immediately. 2. Any fever in a baby under 8 weeks needs immediate medical attention. 3. Trust your parental instinct. If something feels wrong, get it checked. 4. Prevention through vaccines and hygiene makes a real difference. The most important message I want you to remember: you are your baby's best advocate. You know them better than anyone. If you're worried, there's no such thing as being too cautious, here's what to do right now. Save your pediatrician's number in your phone's favorites. Also save the nearest children's emergency room address. Keep a digital thermometer and infant acetaminophen in your medicine cabinet. Print out the warning signs checklist and put it where you can see it easily. Share this information with anyone who cares for your baby, grandparents, babysitters, or daycare providers. If you have questions or want to share your experience, leave a comment below. I read and respond to all of them. Subscribe to this channel for more important parenting health information. Next week, we'll talk about recognizing serious rashes in babies, a topic that 80% of parents get wrong. Thank you for listening, and remember, you're doing a great job. Keep your little ones safe, and I'll see you next time.